dandelion pops up like crazy. It pops up everywhere. And we treat it like a weed. Everyone wants to spray it. Why would we be spraying and eliminating this noxious weed when in reality it could be the answer to our health? There's anti-cancerous, anti-tumorigenic nutrients. There's liver tonification nutrients that are in it as well. And yes, it helps your GI and promotes beneficial bacteria to be produced in the gut. It has a significant amount of antiviral property within it. It actually protects the cell itself from invasion.
There's a noxious weed that grows in our yard that we throw pesticides on, and although it looks kind of nice, we look at it as a blight. And there are nutritional benefits to
dandelion. Today we're going to talk about dandelion. You built that up really well for me, and I think I wasn't quite there.
I wasn't sure if you knew what root we were talking about.
You did. You were doing
We have an
good.
entire podcast set up for it. Dandelion, this is the Be Well Now podcast, and we like to talk about detoxification, liver health, the gut microbiome here on the Be Well Now podcast. You're Dr. Ron Dummar, your clinic here, Community Health and Wellness in Heber City, Utah. You even have an herbal formula called dandelion root tea, but people have heard of dandelion. I don't know if they quite understand how good it is for the body.
Oh, well, it's so good. When I first moved back to this area, we had an acre and a half of just land, like grass that I had to care for and mow and everything. And I loved it. It was good because I was just starting my practice too. So I actually had the time to do it. And one of the things that I noticed is, man, in this area, dandelion pops up like crazy. It pops up everywhere. And we treat it like a weed. Everyone wants to spray it. They want to put these chemicals on it. And the last thing I wanted to do was spray chemicals on it. And so I would go around and I would pick these things and we would care for them really well. And then obviously what we would do is, you still don't want them in your grass, but I would take them out and then I would pluck the flowers and I would pick the roots, try to get out as many roots as I could and get the leaves. And I would put the leaves in salads. And even the flowers, you can steep them, you can put them in a tea. And it's really, really beneficial. All the nutrients that you get from there. There's anti-cancerous, anti-tumorigenic nutrients. There's liver tonification nutrients that are in it as well. And yes, it helps your GI and promotes beneficial bacteria to be produced in the gut. So it's like, why would we be spraying and eliminating this noxious weed when in reality it could be the answer to our health?
So who could benefit from dandelion? And what are some practical applications for it? Because we mentioned it having, or at least off camera, antibiotic type properties?
Absolutely. So there's antibiotic properties, antiviral properties. It may be even more strong in the antiviral department than the antibiotic department. But it has a significant amount of antiviral property within it. It actually protects the cell itself from invasion of the way a virus works really is it comes up to the cell and it basically plugs its internal material, identifying itself into your cell, your human cell. And then it captures your metabolic capacity within your human cell to turn it over and to reproduce and create itself. It captures that like your DNA. And then it teaches your DNA to create proteins, which essentially are the virus. Okay, that's how a virus works. That's how it replicates. It basically heists the train of your DNA and of your cell, takes it over and says, this is ours now, we're running it. Okay, so what dandelion does is it protects the cell from invasion from the virus.
That's what dandelion does.
That's what dandelion does. It protects it at a cellular level. It's actually one of the ways that it does that too is it's very anti-inflammatory. So it prevents buildup or hyper response of the immune system. So it calms the immune response. I had a patient in here just the other day with allergies. He was complaining of allergies and a chronic asthma condition, which he had flares every now and then where he would have to go in and get prednisone. And he's like, that's the only thing that really can knock it out. But we started utilizing some dandelion with him. And dandelion root tea and some other anti-inflammatories. And then we also, with labs with him, we realized that he had a chronic infection that needed to be addressed. So we addressed the infection, utilized dandelion root tea, and we checked on him just the other day, and the lungs and his breathing and his need, the frequency that he needed his inhaler had gone down. So a lot of improvement, a lot of reduction in inflammation, and even flares of his allergies and his asthma.
Well, I've come to you as a patient. I know a lot of patients come to you as a doctor of last resort, right? They've tried everything else.
Sure.
And now it's like, all right, I'll try the natural medicine stuff.
Yeah.
And then you recommend, get your labs drawn. How often is it that, because I know when the infection is part of the labs, you're like, we have to address the viral infection or this infection first. How often does someone have an infection they're working with that you need to address first before you take care of the other stuff?
Well, that's a really good question, because when I look at labs, I'm looking at optimal values. And this is something that people need to understand too, because when they go to their care provider, the care provider's looking at that range you see over on the right. Okay, that reference interval is what we call it. That's range of numbers is basically what they're looking at to determine whether or not you're in or out of health. Okay. Well, that range was established with the understanding that the medication or the treatment that they're going to apply, they know can be potentially harmful or toxic, right? So they know it's synthetic. They know it's aggressive. It's an aggressive therapeutic. So they would rather not give you the aggressive therapeutic, that's actually smart. They would rather not give that to you if you don't have it. If they know for certain you don't have it, absolutely they won't give it to you. But if there's any chance that they think you might not have that condition, they would rather not give you a harmful toxic substance. Okay? So they make that interval really wide so that they can say, even if there's an issue with the lab, or if there's a natural variation, if you're outside this range, it's way more likely that there is a problem. And so if we give you a medication that is potentially harmful or toxic, it's a lot higher likelihood that we're giving you that for a real purpose and reason to bring you back to homeostasis. Okay? So they use a really wide range. That's what you see there. I take that range and I bring it in very narrow, because the substances I work with are not harmful and not toxic. And all they're going to do is benefit organs within your body and push you to a better state of balance and health and homeostasis. So when I look at that, you may be in a state where I consider you, hey, this is actually a dysbiosis, an imbalance of bacteria, or a bacterial infection. Or I might look at it and say, hey, this actually looks more like a viral infection or a parasitic infection, whereas your traditional or your Western medical doctor may look at that and be like, I don't see any infection at all. You're perfectly fine. There's nothing wrong with you. And meanwhile, you're staring back at him being like, I can't think, I can't focus, I can't concentrate, I'm fatigued, and what do you mean that I'm perfectly fine? You look at me and say I'm healthy as a horse, but I don't feel that way. And that's where a lot of my patients are when they come to me. They've been to all these other providers and doctors. They've been told that they're healthy and that their labs, there's nothing wrong with them. They've had imaging, and then they show up at my place and are like, well, what can you find? What can you see? Well, what we do is we narrow that window. We have a more specific eye, and we look into those conditions and say, can we use a little more nuance and dive a little deeper, or go a little bit more upstream and say what really could be causing some of these issues upstream that you're dealing with?
So how often is it an infection when they come in and get their labs done?
So the actual
percentage, they need
percentage,
to address first versus all the other stuff that you address later with Dandelion and all the other things.
The actual percent, that's a great question. The actual percentage, I would say, when those patients come to me, more often than not, I would say they have probably 60 to 70% is an infection.
Because that's what my labs show. That's why I asked you the question. Usually I'm curious about stuff that's involving me, because I'm common. One human. I'm a patient of yours. And that's why we started this podcast. I was like, I have a lot of questions. You're a busy guy. Let's do a podcast. So your staff isn't knocking on the door and asking, hey, it's time to move on to the next thing. So I was just curious. So you address the infection first, and then you address the other stuff. Why not just throw the kitchen sink at it with labs?
You have to address the infection first, because it's the fire burning, right? It's like your house is on fire, and if you don't put the fire out, it's just going to continue to burn, right? So you have to address that infection first. It's inflamed, it's fire, it's burning. Put it out, then clean it up, right? So put the fire out, then tear down, if there's walls that were burned or charred, or if there are 2x4s you have to replace or different things like that. That's what we look at. So all of that cleaning up afterward is saying, okay, now we have a optimal wellness plan for you, right? We need to focus on liver, the relationship between the heart and the kidney, or the relationship between the spleen and the heart, and all of these things we're looking at to say, okay, is your body in proper balance, and are you maximally supported in a way that you can address a potential pathogen that comes into your body, right? So we breathe these things in all the time, and we need to be in a state where we're supported and we're vibrant to be able to fight those things off. Because our immune system should always be checking and always be looking, white blood cells, observing and determining, man, is there a pathogen out there that I need to alert the rest of the immune system to? So we gobble that thing up and eliminate it. And that happens every day. It should be happening all the time without us almost even noticing it. Sometimes it gets a little bit stronger than others, right? Where we feel a little bit run down and feel a little bit tired, and we're not quite, I wouldn't call it quite a cold, but I do feel fatigued. And then boom, I recover and I have lots of energy. That's likely what's going on. The body, the immune system kicks up inflammation throughout the body to clear out a pathogen that it detected through the white blood cells so that it could run it through the lymphatic system and eliminate it from the body.
Folks may want to get their labs done. Community Health and Wellness, Heber City, Utah.
Great place.
We have a description, and your information is in the description if they want to reach out to you. Let's talk about Dandelion. So this is something you would prescribe kind of as a general wellness tea? I mean,
I do.
Could anyone benefit from this dandelion root tea?
This tea that I made is really more like a general wellness tea. Absolutely. And one of the things about it is it's not just dandelion. It also has licorice root in it. Licorice root is really good for the stomach, for digestion, for calming inflammation in the GI. Chen pea is orange peel. And so orange peel itself is a digestive, meaning it's going to help break things down, break foods down, food particle that might otherwise be just fermenting in the gut and the GI and causing bloating and discomfort. So orange peel actually helps break that down. A recommendation I give to a lot of people, a lot of people like to do smoothies. And I say, look, if you're going to do smoothie, wash an orange, cut it up. You can peel half of it and leave the rest of the peel there, cut it up, and then throw it in so that you have actual orange peel in your smoothie.
Half of an orange peel?
Half of the peel, yeah. So leave half of your orange unpeeled, right? But make sure you wash it still. But just leave half of the orange unpeeled when you put it into the smoothie so that you break down all of those peel compounds, which is your digestive agents. You have a lot of, within the pith of the orange as well, you have a lot of fiber, that white part, the pith. So that will also help with digestion and also moving the stools through digestion. There's a big fad right now too to consume higher amounts of meat. Meat only for a lot of people, and oftentimes it will affect digestion. So they won't have as efficient or effective of stool motility, which is movement through the stool. And so one of the things that you can do is consume orange peel or the pith of oranges in higher amounts to try to move and increase the motility so you're getting that 1 to 3 bowel movements a day.
With dandelion root tea, would you recommend this as like a post-meal kind of discomfort? Like, would this be a night? Because I used to do peppermint tea, but then you hear about all the microplastics and tea bags, and I haven't invested in the whole. You got to get the loose leaf tea and the thing to put. So I'm just like, I've given up on
powder.
Tea. This would be a powder. Would this be like a post-meal thing you could do?
Yes, it would be great for that. It does have ginger in it, which is also very anti-inflammatory. It's got gingerols in it, which have been shown in lots of research to initiate an anti-inflammatory effect within the gut and the GI. So very good for the stomach, good for the gut, good for the liver, and it also provides you with a number of different supportive chemicals and compounds, one of them called terrasacin, terrasacin, okay? So it's kind of a fun sounding word, but what this actually does, this compound, is it seeks out, it's like a bitter from the bitterness of the dandelion, but what it does is it seeks out tumorigenic. It seeks out tumors, and it seeks out also the protein envelopment within that wraps around the tumor, and it helps to break that down. So it'll resolve or break down tumors.
Wait, so this is why dandelion can be anti-cancer?
That's right. Yeah.
Wow. So it has antioplastic activity, is that right? Breast, liver, and pancreatic cancers especially?
Yep, exactly. So those aspects of it, we do look at the dandelion root tea as something that can be very beneficial for breast cancers, for even lung cancers, for GI, anything in the GI, the liver, the gallbladder, and the breast.
Man, I want to drink some dandelion root tea right now.
For sure, right?
So,
should we? Here you go.
Yeah. So we've got liver detoxification, gallbladder support, anti-cancer properties,
anti-inflammatory.
Like yeah, this is like your day-to-day stuff. Anti-inflammatory and pain relief. Like, how does dandelion help with pain relief?
Yeah, that's a really good question. So there's another, it comes back to that terazastin. So the terazasterol, it reduces inflammation in the body. Okay, it's a compound that reduces inflammation and actually inhibits. When we look at ibuprofen, people are really familiar with ibuprofen. How does ibuprofen work? So ibuprofen goes in and it stops the production of cyclooxygenase, or COX-2. COX-2 is what we call that. So cyclooxygenase. After cyclooxygenase, if it's not stopped, what happens is cyclooxygenase is produced, and then beyond that we have prostaglandin E1, prostaglandin E2, prostaglandin E3. Okay, so prostaglandin E1 and 3 are actually anti-inflammatory. Prostaglandin E2 is inflammatory, and strongly so, very inflammatory. So when we stop cyclooxygenase, we cut off the production of all three of those. But we're stopping the inflammatory process because we're stopping COX. Well, one of the things that this terazasterol does from dandelion is it goes in there and it disrupts the production of COX as well. So it slows or regulates the production. So it's not cutting it off completely like ibuprofen does, and it's not affecting your liver or your kidneys, it's not harming them. It's actually supporting them, but it's regulating the production of COX so that you have a more ideal production of prostaglandin E1, E2, and E3.
I mean, yeah, kind of went over my head there, but I believe you. It sounded official.
Trust me, that's nice.
Kidney and diuretic action, blood sugar regulation. Like, what does dandelion root not do?
Yeah, so when we start looking this deep into plants, I want to say one thing just about plants in general.
Love plants.
Yeah, well, you have to look at the fact that plants have learned to survive in their environment, right? So they've learned to survive. So there's compounds upon compounds upon compounds. There's so many different compounds within plants. The deeper you dive into any single plant, you could almost say, oh, we have this compound that is anti-tumorigenic. We have this compound that's anti-inflammatory. We have this compound, right, that fights gout. It's like all sorts of things. This compound's diuretic, right? You can find that in almost any plant. So when we look at medicine, it's like, okay, well, if you find that in any plant, why don't we just go around eating whatever we want? Well, the reality is there are certain plants that have specific properties within them in higher amounts, right? So in dandelion, the main ones we really look at are like the antiviral properties, the anti-tumorigenic properties, and the anti-inflammatory properties. Those are really the main benefits of dandelion. Okay. Now, beyond that, does it affect blood sugar? Well, yeah. If you can reduce inflammation, if you can support organs, then of course it's going to benefit blood sugar. And with the kidney, can you have a benefit on kidney if it's anti-inflammatory? It's not going to cause disruption in the tubules that are causing filtration there. Well, absolutely, we're going to benefit the kidney. Great. So taking dandelion is going to be beneficial to the kidney, which is going to help with the filtration rate of the kidney. All right. And so you can absolutely say and argue, yes, dandelion could be utilized for inflammatory type of conditions or conditions that even involve swelling. right, or edema, where we want to increase the filtration rate or elimination of the kidney. Okay, so that's really just a long way of saying plants are pretty darn incredible, but each of them have king components within them that are very specific to certain actions.
Wait, dandelion's good for the skin too?
It is good for your skin. Yes, it's good for your skin. It's great for your heart. It's good for your immune system. Okay, we already talked about how it can benefit and help the immune system, but the skin, it actually has properties that are antifungal. There are actually antifungal triterpenes within them. And these compounds, if you apply it to the skin, and you can see it in a number of different products, skin products that will have dandelion in them, but it initiates an anti-inflammatory and antifungal property within it. So if you are struggling with fungus, right? Some people have toe, or they'll have athlete's foot, or they'll have a variety of different things, especially in their nails. We see that a lot. So you could put dandelion, and you could put something like apple cider vinegar or some other soak combination, but including dandelion in that soak would actually increase the potency of neutralizing the fungus.
Okay. So who is dandelion for?
Yeah. Who's dandelion not for, right? Dandelion is for anyone looking to be wise and preventative about their health. So saying, I want to prevent breast cancer. Well, let's go for breast cancer prevention. This is a great tea for breast cancer prevention. This is a great tea to help support cardiovascular health, heart health. Okay, I want to support my heart. I want to support my digestion and my gallbladder and detoxification. This is a great tea for supporting detoxification. And, we bring up oftentimes that digestive pathway, the CYP450 enzyme, which initiates detoxification within the liver. And dandelion works within that detoxification pathway. So this is great. I mean, who would not be wanting to utilize dandelion?
I'm gonna get some after this podcast. I'm gonna try some of this tea.
Can I tell you one more thing about?
Well, I do. I actually wanted to ask you, if I have it in my yard.
Yeah.
Tell me about the thing, and then I want to talk about how can I just grab it in my yard and use it. Right? News you can use. But yeah, tell me one more thing about the tea.
Yeah. So dandelion, especially dandelion root. I think we talked about a podcast or two ago. We talked about inulin, or we talked about digestive aids, things that you could consume to kind of move the stool, things and ways to improve fiber within the body. Well, inulin is one of those, okay? And you can get super highly ultra processed inulin, which is what we're trying to avoid, or you can get inulin in any root or tuber, right? So if you think of a root or a tuber, you're going to likely get inulin in there. You're thinking of a fibrous type of a plant, okay? So dandelion root itself, especially the root, has a higher amount of inulin in it, which is one of the reasons that it has such a beneficial effect on the gut and the gallbladder as well. So that inulin, which is naturally occurring inulin in its natural state, you harvest the root, the dandelion root, and you can basically chop it up. You can create it as a tea. You can put it in a tea, and then you can dry it, and then you can consume that and get that inulin and benefit yourself with your GI.
And then if it's in my yard, I don't want to put pesticides on it. I want to make this tea because I heard Dr. Dummar say how amazing dandelion is. What do I do?
Yes. So
A to Z. Give me the. I'm going to ask ChatGPT, or I might ask Dr. Dummar. So make it good.
So what you want to do, is first of all, you want to try to disrupt your yard and your grass and your lawn as little as possible. You don't want to be digging with a great big shovel and have a massive, hole in your lawn, right? So try to be as minimally invasive to your lawn as possible, but you do want to get as much root, because if you don't get the root, well, you're likely your dandelion is going to come up again, okay? Now, if you're actually wanting to harvest dandelion and grow it, that's fine, I guess, good. Then just trim it a little bit and it will grow right back.
Now, if I have pesticides on my yard, do I want to do this?
Absolutely not.
Okay,
If
so
anyone has sprayed, and if they've sprayed, I would give yourself a year or two, honestly. If you've been spraying yourself, or if someone sprayed that you've bought the house from, or that you're in a rental and they spray, do not just go out and start eating dandelion leaf, dandelion flower, or dandelion roots, especially if you know that the lawns have been sprayed, because they will transfer to you those toxins.
So let's talk about, we haven't sprayed, we have pesticide-free dandelions. I'm going to disrupt the yard as little as possible, but I do want the root out. So I've pulled out a dandelion.
So
how many of these do I need? What am I doing?
So what I would do is I would get probably 10. If you get about 10. Now, it depends on the size of the dandelion too, because they can grow to be, you can have dandelions grow to be almost 6 inches tall, right? They can be quite large. So if you get, let's say you get a really robust dandelion, you could make a salad almost from that, right? Because you don't want to have it just be straight dandelion. You're going to put some other arugula or some other type of greens in that salad, right? So dandelion would just be a part of the salad. So yeah, that's one thing that you can do, is just take those leaves, just pluck them, and then you can leave the flowering plant and you can leave the root. The other thing you could do is you can dig up the root as well, process the root. You put it into a tea, okay, and simmer it, and then you dry it, the root, okay, and then after it's dried, then you chop it up, and then you could eat it after that.
Huh.
The other thing to do with the leaf,
Eat it or put it in a tea?
I would put it in a tea. That's usually what I would do, but you could literally eat the root.
People were doing this for all of time.
They've been doing it for a long time,
right? So
yes.
it's like, I'm just like, I'd rather buy it in a bottle than I'm afraid to do it in my yard. It's like, this is how people did it. Like, I'd like to get back to getting my hands in the soil and doing stuff like this because it feels more natural to me. But
yeah,
I've
we're more
yet to
connected
ever
with
do it.
where we've been,
Yeah.
right? So the other thing that you could do is you can actually take the flower itself and the leaf, and you can put, I would take 5 leaves and maybe 3 flowers. You could probably take 3 to 5 flowers, put them in a small pan just to simmer, and then pour it off, steep it into a tea, and then you've got a great antioxidant, rich, potent, anti-neoplastic, anti-tumorigenic tea.
Or you could reach out to Community Health and Wellness. I'm sure you can get them some dandelion root tea.
Yes.
Heber City, Utah, Dr. Ron Dummar. How can they reach out to your clinic? How could they get their labs drawn? How could they get a virtual consult? Like, give them some information now on, all right, they believe you, you're the expert, they want to tap into that.
Well, what you could do, Nick, is
I can tell you're something in your throat here.
Yeah, I've got a little tickle, but you could call our number.
He gets emotional talking about dandelion.
657-3696, or you could reach out to us via our website, which is CHW, that's Community Health and Wellness, chwheber.com. And
again, that phone number is
435-657-3696.
What was the last thing you were going to say? I was just trying to save your throat there.
That's good.
Yeah, or CHW Heber.
chwheber.com.
Community Health and Wellness, living pain-free. This is the Be Well Now podcast. Be well now, everybody.
Namaste.
Namaste.